Our sample size for this trial was primarily younger men, but we did have 2 female individuals doing this trial as well. So in future trials, it may be best to expand it to different age ranges, just because we would like to see if there's a way to regain function of the limbs that have lost function due to this disease in older ages. It would also be beneficial to see if females respond well to this treatment as well, given that we only used 2 female individuals for this trial. We could also broaden the amount of testing done. We can try different injection treatments, different regimens on how often it is done, as well as how long it is done for. We can do different studies with different blots. The Western blot tested for protein analysis, while the Southern blot tested for the DNA that we collected. It helped us analyze it with the gel electrophoresis. We could try different blots to see if there's different ways to predict that this will be found due to our trials. Injecting is something that is considered unethical in certain standpoints and viewpoints, depending on the individual who is asked. So it may be best to find different routes of performing this trial and giving this treatment. Also, seeing how often our treatments fail. Given this trial period, we had successfully isolated the protein needed. It would be best to see if that is something that will happen every single time before it is given to the general public who are affected by this dystrophy disorder. Hopefully this will increase the lifespan of the individuals who are affected. It may also increase the mobility and regain loss of limb function, given that that is the main problem that we see with this disease. Increasing the lifespan, we would like to see if the disease will have lasting effects, even if the treatment is successful. Seeing if it is something that can be hereditary or inherited throughout the generations that come after these individuals reach adulthood, whether that is every generation or if that is something that skips generations. It would be beneficial to see that in future trials or to follow up with the individuals of this trial later on in life.